Hi guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review videos, review courses, review books, and one-on-one sessions to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always go over the disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of the videos you may see, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. Question number 1 states, a patient presents to the office for follow-up. He denies any complaints at this time. Patient denies any past medical history. Upon examination, vital signs are blood pressure 142/90, respirations 20, pulse 88 beats per minute, and temperature is 98.0 degrees. What is the best treatment for the nurse practitioner to initiate? Is it A, lifestyle modifications and prescribe lisinopril? B, lifestyle modifications and prescribe chlorothalidone? C, lifestyle modifications and prescribe losartan? Or D, lifestyle modifications and prescribe amlodipine? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is truly being asked. So here, the stem of the question states, what is the best treatment for the nurse practitioner to initiate? So, when they're asking for treatment, you need to run it back and look at the diagnosis. See if they provided you with a diagnosis. And if not, you got to run it back a step further and look at the assessment findings to determine a diagnosis, right? So here, this patient is in the office for follow-up, denies any complaints at this time, doesn't have a medical history. Nurse practitioner is doing a workup, looking at vital signs, and that blood pressure is elevated, right? 142/90. Now, remember, as I talked to you guys about blood pressure and focusing on those goal ranges, I say always just look at those 3 ranges to help you determine on how to maneuver, right? Knowing when you need to treat and then determine how to treat, right? So when do we treat? If the blood pressure is greater than 120/80, you need to initiate lifestyle modifications, right? That's considered that pre-hypertension phase. If they have comorbidities and their blood pressure exceeds that 130/80, you want to start medications because you already have comorbidities. We don't want you to have additional risk factors. Now, if you don't have any medical history, no comorbidities, right? Then if it exceeds 140/90, then you initiate medications, right? So here clearly is greater than the 140/90. So we know we want to initiate lifestyle modifications and a medicine, right? So then you start to think, how do we treat them? So this person, it doesn't tell any ethnicities, it doesn't tell any medical history, so they really can have any of the medicines, right? So that first line panel is your thiazides, your ACEs, your ARBs, your calcium channel blockers, with thiazides leading. So your best answer is B, lifestyle modifications and prescribe chlorothalidone. All right, question number 2. An African-American male patient presents to the office for hypertension management. He states he is allergic to sulfa but denies any other allergies. What is the best treatment option by the nurse practitioner? Is it A, chlorothalidone, B, amlodipine, C, lisinopril, or D, losartan? Take a moment and tell me what you got in the comments, you guys. All right, here, stem of the question states, what is the best treatment option by the nurse practitioner? So again, you're asking for a treatment, run it back and see what the diagnosis is. If there's not a diagnosis provided, you need to run it back a step further and look at the assessment findings so that you can determine a diagnosis to be able to treat it. So here, this patient is in the office for hypertension management. It's an African-American male. He's allergic to sulfa, but no other allergies, okay? So you need to work your way through. If they provide ethnicities, you need to think if those are certain criteria that deem how you need to treat differently. So for hypertension management, we know African-American patients do better with thiazides and calcium channel blockers, okay? So those are the two that we go to for them, for that population, with thiazides being first, right? So in this situation, the patient has an allergy to sulfa. That's a contraindication for thiazides, right? So their best answer is going to be B, amlodipine, because you need to go to the next step, your calcium channel blockers, right? So again, the African American population does best with thiazides and calcium channel blockers. So that's why you also need to pay attention to the demographics and all the stuff that they are leading with, age, ethnicity, all of the things, because it ties the whole story together for you. And so since we know that thiazides and calcium channel blockers are best, and they respond better to this for hypertension management, we go with these. But with the sulfa allergy, it eliminates the thiazide, so go with the calcium channel blocker. All right, and lastly, question number 3 for today. The nurse practitioner and NP student are discussing thiazide contraindications. All of the following are contraindication to thiazides, except, is it A, gout, B, sulfa allergy, C, hypokalemia, or D, hyperthyroidism? Take a moment and tell me what you got in the comments. All right, so stem of the question states, all of the following are contraindications of thiazides except. That except is letting you know which one is incorrect, right? So thiazide contraindications, gout is a thiazide contraindication. Sulfa allergy, we just talked about that, is a contraindication with thiazides. Hypokalemia is a contraindication of thiazides. Hyperthyroidism is not. So your best answer here is D. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure you meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio. You can give us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Things that we offer is my review book, either in the ebook option or the paperback option. Both options are linked in the bio of this channel. If you're looking to just study independently on the go, I have a self-paced review course that is broken down per system and is designed for family and adult gero for both exams, the AAMP as well as ANCC. That's also linked in the bio of this channel. Our 5-week group intensive, the next one up and coming, will be in September, so be on the lookout for that. And then the one-on-one sessions that I offer, I break those down into 3 different tier options. You can book sessions for weaknesses, you can book sessions for an exam readiness assessment, or you can do the most popular one, which is the custom package. And with the custom package, you are provided with a pretest so that we can gauge your strengths and weaknesses based on the timeline that you have that you want to study and allot to this period before you test. I structure a study plan in that timeline, work alongside with you to take you to a successful exam day. So if you need any of those things, especially those one-on-one, I always say reach out to us so we can gauge what truly is best for you. And then also, again, I don't typically announce this. It's usually after I've worked with students, but I do very little VIP sessions, and I have one available for August and September. VIP is typically designed for if you have had trouble successfully passing boards, you feel like you have done it all, you've tried it all, but you just can't meet the mark, and you're ready to invest in a 8-week strict study plan, then I do have one additional slot available. I already have somebody else signed up for the VIP there, so I can do one additional one because I am really hands-on with you guys during that time period. So if that is something you're interested in, please reach out about that, because I have to really truly gauge if that's what you need, if that's what you are able to do, because it's a very strict study plan. Okay. But as always, you guys, make sure y'all meet me back here. Happy studying. Bye, y'all.